Welcome aboard the Just Help Out Mindset podcast, where your compassionate guide, Nicole Venegas, takes the helm. Brace yourselves for an immersive experience as we delve into the heart of crucial conversations. We're set to explore the intricacies of suicide prevention, navigate the landscape of mental health, and boldly shatter the stigma surrounding therapy. This isn't just a podcast, it's an odyssey of resilience and understanding. Join us on this transformative journey filled with stories, insights, and a collective mission to create a world that embraces the strength of empathy and helping others. Fasten your seatbelts. We're about to embark on a voyage towards a healthier, more compassionate existence.
Welcome, listeners. I'm your host, Nicole Venegas. This podcast is named after our nonprofit called the Just Help Out Foundation, which is located in Tampa, Florida, and was created from a pure tragedy. My brother died by suicide on May 3rd of 2022, and that horrific day will be forever etched in my brain. A few days before he did it, he said he was feeling hopeless, so our nonprofit organization helps anyone in the community who may be feeling hopeless. And everyone that we help in the community is called a Joey. So far, after being around for 1 year, we have been able to help almost 50 Joeys since our inception, from homelessness, hunger, domestic violence, and mental health. The purpose of this podcast is to explore mental health in its entirety and to let everyone know you are not alone. If you think you are the only one suffering from anxiety, depression, OCD, panic disorder, agoraphobia, I challenge you to think again. I am also a mental health professional and see clients daily who are strong and courageous, and they have decided to talk about their feelings and process unturned stones in their lives. I hope you will do the same with me here today. Welcome to episode number 10 of the Just Help Out Mindset podcast. We have a special treat for you today. In the studio, we have Miss Natalie Suazo. I'm so excited to chat with her. She is a licensed clinical social worker who graduated from University of South Florida. She's been in the mental health field for 12 years and is the owner of Breaking Ground Counseling. I am super excited to ask her because her specialties are men's issues, military populations, then prenatal postpartum depression, and she's a trauma-informed birth doula. So we have both ends of the spectrum there. And her passion is working with people that are going through their toughest moments and watching them transform into the best version of themselves. Is that not the best thing that you could ever hear from somebody in this field? So I am very excited to also ask, Natalie did her internship at MacDill Air Force Base. She was the first one to do her internship there here in Tampa, Florida. Welcome to the show, Natalie.
Hey, everyone. So happy to be here today.
Thank you so much for coming in today. I am absolutely so impressed that you were the first one to do your internship at MacDill Air Force Base. What was that experience like?
Oh, it was incredible. Honestly, it was a huge privilege even to be there, and I didn't know what my experience would be like since I, was the first master's degree student there. But I had wonderful leadership there and really felt like I got to give back to those who have served our country by just, being there and learning, allowing, them to teach me as well.
That's phenomenal. And the whole premise of our show is to break the mental health stigma, and that population, when we talk about military, when we talk about first responders, anything in that category, and the level of PTSD that they suffer, and they don't want to talk about it. They don't want to go. They don't want to talk about their feelings. They don't want to seek help. What did you see while you were there? Did they have to come see you, or was it voluntary?
So it can be both. I think one of the most difficult things about that population is the fear of, okay, if I go in for mental health treatment of any kind, like counseling, then, what if my first sergeant finds out? How will this affect my career?
Yes.
Especially specific careers that involve firearms, any sort of like component like that, where if your mental health was in question, would you still be able to do your job? I mean, there is a lot of fear behind that. So that is a major issue that I would see, but also the expression of masculinity and what that means. And, how they can express that in a healthy way and encouraging that, especially in military culture.
Absolutely. I'm so happy. I'm so happy that you worked with this population, because this is a population that for years, and I know it's getting a little bit better as we talk about more mental health, but for years, they would not even let them go to therapy.
Mm-hmm.
And I'm glad you brought up the firearms perspective, because how did you navigate that as their mental health clinician, knowing that they didn't want to tell you what was really going on in case that diagnosis would affect them keeping their firearms? Tell me how you handled that.
Ultimately, therapy works is because you build that relationship with them, and there's a trust, and it very open from the get-go. So talking about the risks and benefits with the client, letting them know, like, hey, I want you to have informed consent before you have any type of counseling. These are the things that could happen, and letting them have a pure understanding of that, and then going in, building that relationship very strong, non-judgmental, and then it kind of free flows from there. And I feel like out of trust comes everything.
Absolutely. The rapport. It is the core piece of the foundational relationship with your client, because if they don't trust you,
they're not going to tell you anything.
Nothing.
I wouldn't either.
Absolutely. Absolutely. And I've talked about my own personal journey in finding my own therapist. Yes, therapists have therapists who have therapists.
Of course we do.
And I went through 5, maybe 6, and I did not feel the connection. They were not warm and non-judgmental. They were kind of putting their views on me, or they would just talk about themselves the whole time. I'm like, this is not how it's supposed to go. So it's very important that they feel comfortable with you. Now, what I want to talk about, because you had mentioned when you have someone and they've gone through a very hard time and you love seeing them come out of that hard time. Is there an example of a client that comes to mind, or a situation that you remember where the specific individual had such a difficult time in that first session they came in just completely defeated, and then they left feeling so much better?
I can think of a combined amount of clients with a similar issue. So I'll have clients come in, and maybe it will be, I don't feel fulfilled in my career, or kind of feeling lost in that, or I find myself self-sabotaging in my relationships, can't seem to find someone who's stable, just this lack of peace in a lot of areas of their life. And there's a lot of strife. Maybe it will be they grew up not having a really healthy relationship with their parents. Maybe there's a lot of chaos. And then we get to a point in the session where I ask them, do you feel like chaos just kind of follows you in your life? And sometimes a light bulb goes on, and it's like, I wonder if you growing up were so used to chaos that you work in that. So whenever peace comes along, whether it be a really nice job where you're like, I feel like I can thrive in this, or a partner where you're like, man, I feel like this could work. And then you find yourself saying, too good to be true. There's no way.
Absolutely.
So then once we can narrow down that and figure out this is what the issue is this kind of thriving on chaos, then the self-awareness appears, and we're like, oh, okay, this is how I can find peace and stability. I have to be comfortable with that.
Yes.
So moving forward, sometimes it is those small moments. It can take a few sessions, really, but just I found a lot of clients thriving on chaos and not even realizing it.
Absolutely. That's the beauty of the talk therapy, because You can have so many thoughts all day long in your mind, but they go nowhere.
Right.
Other than cause you anxiety, depression, insomnia, on and on and on. But then you talk to someone who is a hopefully non-judgmental person, and they just create that safe space for you to open up. And so many aha moments happen in that space.
Oh, it's amazing whenever that happens.
So good. So good. So along with the military, was PTSD one of the main diagnoses that you had seen while doing your internship there?
I would say, yes, it was prevalent. But to be honest, what I also saw was like adjustment disorder. So you would have military service members that have just PCS. So they moved from one base to another very suddenly. Maybe they have their families with them, and it's a huge adjustment. Maybe they're doing a new type of job or moving to a new climate where they don't know anyone. And there's that adjustment period that, typically if it's within 6 months, that's whenever. If it's still happening past then, it's like, okay, we have an issue.
Yes.
But just the constant change, whether it be of places that they are going, jobs, or supervisors, that is something I see quite a lot, actually.
How did you help them with that big? That's a huge transition in life when people are being stationed, even overseas, and then they come here and they're so far away from where they're originally from. How do you help them with that?
I think finding some sort of stability and normalcy as much as you can.
Yes.
So whether that be if you're stationed in Okinawa and, you don't know anyone, then there will be people there in a similar situation. So it's also about being willing to find that community, even though it may be uncomfortable or awkward. But there's people that are going through similar things as you. We just have to find them.
That's right. Finding connection. That's huge. Absolutely huge. Well, what advice would you give to someone in the military right now who is going through a tough time? Say they are having suicidal thoughts, they feel very lonely, they are isolating, but they will not talk to somebody because they're so afraid of what that person might think, or what their person above them in the ranks may think as well. What advice would you give them?
And I can even think of this perspective. I actually forgot to mention I'm a military spouse. My husband's a veteran.
Oh,
so
I did not know that.
Oops. He's been a veteran for a while now, so I kind of forget that life a little bit. But I think one of the main things is remembering that you as a healthy person is going to be the most important thing. How you do your job, how you raise your family. If you're not healthy first, then it's not going to go well anyway. But ultimately, I would reach out to other groups if you're scared to get help from maybe the mental health clinic on base. Then reaching out to a therapist privately. I mean, there's a lot of organizations. Military One Source provides free therapy to families. I know some military service members may be a little intimidated to reach out through their insurance or worried that their command might find out, but there are programs even at the VA that can help for sure. I know Camaraderie Foundation is also one that provides free therapy, but we are out there and we do want to help you.
Yes, and that's an overlapping theme in these episodes is that you're not alone. There are people that care and they love you and they want you to stay here. And it's hard to feel like that when you are always in isolation or you're always moving and you feel like you are alone, but you're not. So Military One Source, the VA, Camaraderie Foundation, they offer free counseling.
Yes.
That's fantastic. I did not know that. So those are some resources to check out as well. Now, I want to make the switch here quick because the men's issues and military and then over to postpartum.
Yes.
And being a trauma-informed doula is fascinating to me, because I just had 2 babies and you just had 2 babies.
I did.
Literally 8 weeks ago, everybody.
Not twins, though.
She had a baby 8 weeks ago. She's here in the studio talking about mental health. Oh, that is so inspirational. So talk to me about postpartum depression, because that is a serious issue that has increased over time. People didn't even know that was a thing back in the day. And these women were taking their own lives after they had the baby, and nobody understood it. So talk to me a little bit. I think I experienced it a little bit after I had my second baby, because while I was pregnant, my brother died by suicide. And so I held on to a lot of that while being 6 months pregnant. So then we had our other child, who was 1 at the time, a newborn baby, dealing with my brother's passing and sleep deprivation.
Oh, yeah.
And my husband being a first responder, he's gone 24 hours. It was just a complete dark cloud. I remember that for a couple of months. They never diagnosed me with postpartum, but I would say, knowing what I know, it probably was. I was very sad, crying a lot. So talk to me about your experience with postpartum depression.
Well, even personally myself, I think when I noticed with my first child, because I did not really have any experience with postpartum depression clinically until, I had my first child. And then I realized something wasn't quite right. And a lot of people who experience postpartum depression may have like intrusive thoughts that are really scary, or that they don't want to say out loud. Maybe it can be so intense. Maybe some of those thoughts are like even violent, which sounds, terrible even to say out loud when you just had a baby. But there's so much stigma and so much fear behind that. But I would say overarching, whenever you just have a baby, there's so many things to consider. You have prepared for 9 months and maybe had expectations, whether those were, this birth is going to go so well, or I'm terrified of birth. And whatever happened in birth, whether it was positive or a negative experience, then you go home and you're not only taking care of a new life, but you're also processing one of the biggest things that's happened to you.
Absolutely.
And add in just hormones coming in, as a new mom, like your milk comes in normally like the 3rd or 4th day sometimes. And that's something that we don't talk about. It's that surge of hormones that can come in, prolactin and other hormones that can, it can kind of mess with you a bit, can kind of make you feel more anxious. And, that's normally whenever people say, oh, you have like the baby blues, is whenever you're kind of feeling a little down, maybe just kind of getting used to everything, sleep deprivation. But whenever it turns into, okay, I don't feel like I can function. I'm really scared of these intrusive thoughts I'm having. I'll give actually an example of one that I've heard before. Is I had a mom client who was kind of fixated protecting her babies, the soft spot, the fontanelle, like on the head, like protecting that, thinking, oh my goodness, if something happens, no one can touch the baby's head. If something happens to my baby, it's going to be my fault. And, there's some fixations that can happen in that as well. But I think just all those things combined, emotional, physical, mental, can create like the perfect storm sometimes.
Absolutely. And would you say that giving birth is traumatic?
See, I kind of have a different perspective. I would say as a birth doula, especially trauma informed, I have clients come in and say, I am terrified of birth. Here's all of my fears. I don't know what to do. My job then is also to empower them, saying like, this is, you can do this. Like, let's speak life over that. Like right now, like you can have a very peaceful birth, even if it doesn't go the way that you planned, and you can walk out of there. You're going to walk out of there a mother, a new person. Let's cling to that.
Yeah, absolutely. I remember my first child, Joseph was out, and then I was also kind of out of it, but the doctor said his heart stopped, and then called for the cardiologist, and then
oh my goodness,
I was like, what? That's like a shock and a whole, when you're on that table, not only is a whole room full of people, and your legs are spread, and you have to push out a human. There's so many different factors into that experience, and not only the pain, everyone's staring at you, and you have to get this baby out. just that experience alone can be super traumatic for people.
Oh, yeah.
Of course, it
Very vulnerable.
Absolutely.
And I think something that does help clients working with a birth doula too, or even like a therapist like specializing in this, is you can't prepare for something that's, there will be unknown components, but having the preparation of what to expect, like stages of labor or what I can do for pain relief. How can I prepare my mind, like mentally and even spiritually as well, to go into this with my best foot forward and knowing that I have the power to do this and I can have a beautiful experience. It doesn't have to, even if it's unpredictable and there were things that happened that you didn't know, you can walk out of there feeling like, okay, I prepared and I did everything that I know that I could do, and I'm still strong for it.
Fantastic. So your belief is that if someone can prepare, and I think a birth doula is amazing to have. I wish I did have that. If I ever had one, which we're not having anymore, I would have a doula. But I think that they help you stay calm, prepare. And when you're prepared for things, your fear goes down, your anxiety goes down, and then you also feel safe. So very important. So we are getting ready to wrap up the show, but I do want to get your take on what advice you have for partners who are with someone who is going through the postpartum depression, or they're struggling with depression and they have suicidal ideation and they just had a baby. What would your advice be for that?
I think creating a safe space, really, without judgment, and just being able to ask, like, are you okay? Sometimes a simple question, are you okay? And allowing that space to be open where if there is like, no, you know what? Like, I'm really not okay. I'm about to lose it. Like, and just opening up that space and then talking it through. Let's get you help. I want to help you. You know what? I'm scared too. Be honest and vulnerable and say, let's get through this together. And that just, even if you are going through, postpartum depression, anxiety, any of those postpartum disorders, like, it's having a partner that's available, even if they are scared, and knowing like we're going to get through this together is the best thing possible, as well as community. I cannot say that enough. In America, we are a very individualized society.
Absolutely.
Mental health is very private. We don't like to talk about these things, but having a partner that really supports you, as well as a community that you're willing to be open with, I feel like is key when you're going through all those things.
Absolutely. And I don't want to leave men out of the postpartum, because I think that it changes them.
Men can also get postpartum depression.
Yeah, absolutely. And they'll never talk about that.
No.
That ever. I never hear that. Ever. So it's important that men feel safe to say that, yes, we had this baby, but I'm like having these thoughts. And
well, also their connection with the baby, they weren't carrying the baby for 9 months. So they're having to build that relationship as soon as the baby's out of the womb.
Absolutely. And for people that don't have a support system, because I've seen that as well, I'm sure you've seen that too, they don't have a significant other, their parents are not supporting them. The community aspect is so important to find a local church or a local group, nonprofits that help with newborns who are or the parents of the newborns that are by themselves. And lastly, sleep is so important in that phase. If you could just let the mom sleep.
You know what's so important? I learned this with my second child. Come up with a plan.
Yeah.
How are we going to take care of this baby? What's the night shift going to look like? Who's responsible for the household chores? Like, what are we going to do? And then revisit that plan often. It is subject to change, because then that way, what if baby only likes to sleep a certain way? And then, well, your first plan's out the window. So lots of communication.
Communication, planning, preparation. My husband and I hired a sleep coach.
Oh, okay.
And everyone was like, what's that? But I will. We could do a whole episode on that. The babies slept from 7 to 7 from 3 months on. So.
Oh, that's fantastic.
It's amazing. That helps.
Great for you.
Great. But those first 3 months, it was not good. So do you have any last advice or tips for anyone that might be really struggling with men's issues or postpartum or low self-esteem or just not feeling good being in this world?
overall, and I know I've kind of touched on this, but I feel like the most important thing is to find that community. Like, a lot of people are turned off by the phrase, it takes a village.
Yeah.
You know, whether it's yourself or you're raising a child, I would ask yourself, you know, let me put in the work to also find that community. And it might be uncomfortable going to those mommy groups or, you know, going to whatever groups there are, like church. It might be uncomfortable. You may want to sit in the back and not talk to anyone. But if you just keep holding on and make that effort, even though you may stumble over your words, you just might make a friend, and life will be much more manageable. So I would say just keep going.
Love that. I love it. Natalie, thank you so much for joining us today. How can people find you?
So you can find me at breakinggroundcounseling.com. I also have a Psychology Today profile for those that are aware of that database, and you can just look up my name, Natalie Suazo. But thank you so much for having me on today.
Thank you. That was phenomenal. Excellent advice. Excellent topics. Again, if you're going through this, you don't feel good, you just don't feel right, you're having thoughts that you don't like, reach out. We're here. We care. We want to help you, and we're not here to judge you. And I want to thank all the listeners so much for supporting us in helping to break the mental health stigma. It has been such a pleasure today, and I hope you tune in next week for another episode of the Just Help Out Mindset podcast.